I'm Dr. Jennifer Ashton. Welcome to Health and Wellness. For the past several days, I've been working in a medical clinic in Port-au-Prince, Haiti, treating some of the most seriously injured victims of the earthquake. I would like to share with you some of the experiences we've had here. 10 p.m., Port-au-Prince Airport. Our team of 11 doctors and nurses from Florida lands.
Orthopedics.
And within minutes, it is literally all hands on deck. This is a 6-month-old baby girl who sustained second and third degree burns to 40% of her body. This is a cream that helps with healing and helps to prevent infection. We're also giving her antibiotics and pain medication.
On my count, 1, 2, 3.
At 3 a.m., a small miracle. This 15-year-old girl, known only as Lovely, was trapped under a school collapse, a dead body on top of her, and her arm pinned by concrete. EMT Dr. Mark Grossman had but one choice.
I had to go in and try and amputate her arm.
And what equipment did you have with you?
First I tried with a scalpel to cut through the skin, but it was the way she was positioned, I couldn't cut all the way through. And then I had to use an electric saw that we use for regular rescues, like to cut people out of cars.
But it worked. I helped resuscitate Lovely and monitored her vital signs as surgeons tied off the major blood vessels in her arm.
From your report and others, we've heard about the broken bones and those crushing trauma injuries keeping orthopedic surgeons busy. I know you're an OB/GYN by training. What other kinds of doctors are there?
Every kind, and every kind is needed because while the majority of the injuries do involve bones and crushing injuries, make no mistake about it, there are a lot of children who are sick and injured, so pediatricians are needed, anesthesiologists are needed. We can't talk about doing any kind of surgery without pain control and pain relief. Infectious disease doctors, they need as much help as they can get. I've been here less than 48 hours, and it's hard not to get overwhelmed. A 2-month-old baby girl was rushed into our makeshift medical clinic after being pulled from a pile of rubble.
Anybody have trauma shears?
She had sustained 2 depressed skull fractures, had multiple fractured ribs, and was critically dehydrated. She was about 2 to 3 months old, and at our medical unit that we were working at, they pulled her out of the rubble 4 days into the disaster. We worked on her for about an hour, and she actually would not have survived on the island of Haiti, so we were able to airlift her to Miami, to Jackson Memorial Hospital, where she is doing well. She needed to be put on a ventilator, but again, that's a perfect example. It's not just the doctors and nurses being here, it's the facilities and the equipment that are right now non-existent. Another day and more crises. The cobbled-together volunteer clinic where we've been working is maxed out. Too many injured, too few facilities. The UN owns the land where the clinic's been staged and needs it back.
Take a list of the names that you're doing, okay?
So the whole operation will move. This UN bus was our evacuation ambulance, even though its doors were too narrow for the stretchers.
Make sure he doesn't fall out.
During the jarring, dusty 3-mile drive, an infected patient nearly went into cardiac arrest.
Drop the camera. Here.
The second one, who's second most critical, is a 5-year-old boy. Then this girl has a pelvic fracture. We don't even have the ability to really stabilize her.
So we'll take this lady and we'll take the one, there was a kid here as well.
But we arrived to an incredibly welcome sight, the Israeli Field Hospital, the Rolls-Royce of emergency medical care. Set up in just 8 hours and able to handle 500 cases a day. About 50% of the patients are women, 30% are children.
We've been in Kosovo, we've been in Turkey, in India, in Kenya. It's the biggest disaster I have seen.
The update for some of the patients that we've cared for over the past 3 days varies widely. Some have died and others are on the edge. This is a 6-month-old baby girl who sustained bad burns. These are severe burns, and she's at real risk for dehydration and infection. This is a baby that if we were in the United States would be in an intensive care unit. So we're here with Lovely. 2 days ago she was found under rubble. She's alive, but infection is setting in. We're actually going to take her back to the operating room today to clean out the wound. And hopefully she'll do okay. Better news today for a 2-month-old baby girl who was trapped beneath rubble for 4 days. She's in critical but stable condition.